Welcome to Suite 250 at Cool Springs Foot Care. My name is Dr. Lance Reeves, and today we're going to talk about what you can expect after minimally invasive Tailor's bunion surgery. There are a lot of people out there who don't want foot surgery because they're afraid of the pain and the recovery process, but I'm here to tell you that it's probably not going to be as bad as you think. Again, with my technique and the minimally invasive surgery that I perform, it creates a smaller surgical footprint, which a lot of time results in less pain, swelling, and scarring for that patient. First, we're going to talk about what to expect as far as walking after this procedure. You will be walking the day you have the surgery. That's right, the first day you have the surgery, you will be walking out of my office and you will be walking throughout the entirety of the post-operative course. I found that walking patients more quickly dramatically decreases the amount of atrophy that goes on in the lower limb, and it also can help speed up the recovery process, making it more comfortable for each patient. Of course, you will need to take it easy for a few weeks. You can't do all of your activities as normal, but you are still able to walk around the house, small errands, using the restrooms, things like that are perfectly fine to be walking on after this surgery. Next, we'll talk about what you'll be wearing on your foot for the recovery process. It will either be a walking boot or a surgical shoe. Typically, the more extensive a procedure is will mean a walking boot, and the less extensive a procedure is will mean a surgical shoe. Also, if a patient is a fall risk or has an unsteady gait, then they are much more likely to be in a surgical shoe versus a walking boot, as a walking boot can be difficult for people to get around it. Ultimately, I decide between the surgical shoe or the cam boot, but I always take into account what's going to be in the patient's best interest and what's going to be safest for them throughout that post-operative course. The length of time that someone is going to be wearing their post-op shoe or the walking boot is going to be determined by how extensive the procedure is. For a larger procedure, more time in the boot or the shoe. For a smaller procedure, less time in the boot or the shoe. Typically though, patients are in a boot or a shoe for only 2 to 4 weeks. Sometimes that can go up to 6 weeks, but that is a patient-by-patient determination. Pain is a very common concern for patients anytime they're thinking about foot surgery. Again, because I do a minimally invasive approach, which means tiny 2 to 3 millimeter incisions, your pain, swelling, and scarring are all going to be less than your typical open surgical technique. Most of my patients get away with only Tylenol or ibuprofen for their post-op pain control, but rarely in some cases I can prescribe a stronger pain medication if it's necessary for patients to be comfortable during the post-operative course, but rarely have I ever prescribed that for more than just 1 week after these types of surgeries. For me personally, I like to see my post-op patients consistently and every time they come to the office, so this allows me to help them and guide them through that post-operative pain control and be closely connected to make sure that they are comfortable and I'm not missing anything for them. For the first few days after the surgery, it's important to rest, take it easy, kick your feet up. I always tell patients to elevate your foot to the level of the heart. Even though this is a minimally invasive technique, there is still going to be some swelling, and the more things you can do to help with that swelling, the less pain you're going to have. After my minimally invasive Tailor's bunion correction, I like to see patients 3 days after their surgery, and after that I'll see them weekly for 5 weeks. I like to stay very closely involved to my patients after surgery to make sure they're getting the best possible outcomes. I also want to be the one doing every single post-operative dressing change for the patient. If they took the time to allow me to do their surgery, I want to take the time they deserve during the post-op course to make sure their foot is properly bandaged, properly splinted, and everything is healing appropriately through the post-operative course. As the days pass, you will gradually get back into your normal activities, but there are several things that need to happen before you get back into full activities. The first one is radiographic healing. This means that the bones are healing on x-rays. The second thing is making sure the incisions are healed and the swelling is decreasing at an appropriate rate for that patient. Next, patients will transition out of the surgical shoe or the walking boot into a normal fitting shoe. After that, it's range of motion and simple strengthening exercises, and these are dependent on what surgery the patient had and how quickly they can return to some of those things. And lastly, it's getting back into your previous surgical activities. I always tell patients start slow and gradually work up to some of those pre-surgery activities. Physical therapy is always a great option for patients. I always like to let patients dictate when or how much they need as far as a physical therapy standpoint. If a patient feels like they would benefit from it, then I'm more than happy to get them into physical therapy. On the other hand, if they feel like they're progressing well and they don't want to see a physical therapist, then that works too. I'm happy to do what the patient is most interested in. Now we can recap some of the highlights of things to expect after you get a minimally invasive Tailor's bunion surgery. First, you will be walking immediately after surgery in a surgical shoe or walking boot for roughly 2 to 6 weeks. Tylenol and ibuprofen in most cases are the only pain medication you're going to need to make you comfortable after this surgery. I will be the one and only one doing each and every single dressing change for all your postoperative visits. Lastly, you will be getting peace of mind knowing that the surgeon who performed your surgery is seeing you every single time you come in the office and making sure you are progressing properly throughout your entire postoperative course. If you have any questions about minimally invasive Tailor's bunion correction or feel like you may be struggling with this, please call the office at 615-567-5622 or visit us online at coolspringsfootcare.com. Thanks so much for watching this video. If you found it helpful, please like, comment, and subscribe to our channel.